Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar topic is ensuring safe water management in nursing homes. Everyone has entered today's meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is managing common infections in nursing homes, prevention, isolation, and intervention. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our speaker today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer, thank you for joining us again today.
Thanks, Kathy, and welcome everyone to today's webinar on ensuring safe water management in nursing homes. We'll be discussing key strategies to prevent waterborne pathogens and things to help comply with regulations and safeguard our residents' health. So our objectives today are to understand the risks associated with waterborne pathogens, learn how to implement effective water management strategies, and ensure that nursing homes are compliant with regulatory standards. These critical steps in maintaining a safe environment for our residents and staff. To get us started, we'll talk a little bit about water systems and why water management matters. Waterborne pathogens can be a hidden but serious threat in nursing homes. Due to their age and underlying conditions, residents are highly susceptible to infections like Legionnaire's disease. So, having a strong water management program isn't just best practice, it's a regulatory requirement. And a lot of times, as administrators, directors of nursing, and IPs, we don't have, hands-on experience with it. So, we're going to go over some things today. So, let's take a look at some of the most concerning waterborne pathogens. Legionella, which is particularly dangerous as it can be spread through water systems and can cause a very severe form of pneumonia. Pseudomonas is often linked with infections in wounds and in the respiratory tract, while NTM can cause chronic lung infections, especially in vulnerable populations. So the major focus on water management system a lot of times is the Legionnaire's disease. So what exactly is Legionnaire's disease? Legionella pneumophila was first identified as the infectious agent causing pneumonia among attendees of the 1976 American Legion Convention in a hotel in Philadelphia, Pennsylvania. This type of pneumonia is often known as the Legionnaire's disease. The Legionella bacteria natural habitat is in water, especially warm bodies of water, and it is chlorine tolerant, so it survives the water treatment processes and passes into the water distribution system in small quantities. And the disease is transmitted through inhalation or aspiration of contaminated water. Legionnaire's disease is a severe form of bacterial pneumonia. For example, of the 4,001 confirmed Legionnaire's disease cases reported in the Supplemental Legionnaire's Disease Surveillance System in 2015, 96% or 3,836 people were hospitalized. And approximately 1 in 10 individuals who contract Legionnaire's disease will die from the infection. So who's most vulnerable to Legionnaire's disease? So our residents, specifically those who have certain weakened immune systems or chronic disease, are at high risk for Legionnaire's disease. Other risk factors are advanced age, um, male gender, cigarette smokers are at higher risk, people with chronic obstructive pulmonary disease or COPD, people with weakened immune system, if they're on long-term corticosteroid use, and underlying illnesses such as diabetes, renal disease, and liver failure. In a nursing home, water systems extend much beyond just the drinking water. Any water source, such as showers, sinks, and ice machines, can become a breeding ground for harmful bacteria. So take a look at those showers and sink systems, and also ice machines. They should be cleaned and maintained on a regular basis. Stagnant water is particularly dangerous, which is why it's so important to flush any unused outlets. Um, Look at your cooling towers, decorative fountains if you have those at your facility, your HVAC systems, and those areas of stagnant or low flow water. Because of the risks associated with waterborne illnesses, it's very important for facilities to work together to have a really strong water management program. Creating a water management program starts with forming a multidisciplinary team, and this group should include your infection preventionists, facility engineers, and leadership. It should start with mapping the water system and help identify risk points and the routine monitoring to ensure early detection of potential problems. And your program should be reviewed and updated regularly to make sure that all the components are there and that it's working effectively. And we'll talk a little bit more about that in just a bit. So, who should be on your water management team? Your building owner, manager, administrator, infection preventionist, but also include people from your risk management department or someone who understands regulatory and licensing requirements, your maintenance department, safety officers, your water treatment consultant can be pulled in, microbiologist can be pulled in, or other certified industrial hygienists. And also take information from your state and local health officials to help strengthen your program as well. But it's really important to conduct your surveillance, monitoring, and mitigation of waterborne illness risks to ensure the safety of your residents. So make sure to review the elements of your water management program at least once a year to ensure it's up to date. Additionally, you should be reviewing it whenever any outstanding issues occur. Things like control measures being persistently outside of the control limits that you set, according to your data review, any major maintenance or water service changes occur, such as new construction or equipment changes, like if you get a new hot tub or chlorinator pump, or any changes in your treatment products, such as your disinfectants. Also, take a look if any changes in your water uses. So, might have to be evaluated during high or low season, or any changes in the municipal water supply. So this is a algorithm that the CDC has put out. They have a really nice Legionella toolkit to help you with your water management plan, and they outlined a few um, steps to make sure that you have a really strong water management plan. So the first step is to establish that water management program team. And then the next step is describe the building water systems using text flow diagrams. So a lot of times your maintenance department will have, a map of the building or like some sort of blueprint to see where your water lines go. But you need some sort of description of your facility's water system. You can have it by text, write a simple description of how the water comes into and flows through your building, or that flow diagram, a visual illustration of your water system and how things are flows through your facility. And that will help you identify any areas where Legionella or the other waterborne pathogens can grow. So that's a really important part of your water management plan, identifying those areas where Legionella can grow and spread. And special attention should be made to areas of high temperature. As I mentioned before, Legionella thrives in warm waters. So if there's any areas where warm water is able to collect, you want to take a look at that. Any areas of stagnation, if you have any, parts where it's not a direct flow, you have any cutoffs in your system, look at those areas where disinfectant isn't going, or any conditions of bacterial spread or external hazards such as construction or water main breaks. Another place you want to look at are your medical devices, things that aerosolize water. Also, your decorative fountains, your spas, hot tubs, and your eye wash stations. Sometimes those are areas that can be an area of stagnation. We don't use those all the time, so make sure they're being, flushed every once in a while and make sure that the bacteria is not able to grow there. Also, your humidifiers, any centrally installed misters or atomizers, any faucet flow restrictors or aerators. And also take a look at your shower heads and any electronic or manual faucets. A lot of times the electronic faucets have those aerosolizers on there that make kind of a mist, and that's how you can transmit that bacteria and breathe them in. The next step is implementing control measures. So making sure that you have your strategies for your control measures that include maintaining your water temperatures that prevent bacterial growth, flushing outlets that aren't used frequently, using filters in high-risk areas, and also routine testing is key to early detection and having a response plan that ensures swift action when contamination occurs. This is a nice diagram that was also from that CDC toolkit that I mentioned. Looking at the control measures and corrective actions. So if you have your control points that you've identified, such as the water heater, if you have a hot tub, or any other things you feel like could be high risk, you have your control measures in place. And you'll do your routine monitor if it's within limits, document your results, and that's great. But if you've documented your results and it's outside of your limits that you've set, make sure you're making that corrective action, and then if it's continually out of limits, look at the measures itself and make sure that they're sufficient. You want to make sure to establish ways to intervene when control limits aren't met. So your corrective actions are dynamic. You should plan for your monitoring results to vary over time, but be prepared to apply corrective actions if it's way outside of the limits. And corrective actions are taken in response to systems performing outside of control limits. As I mentioned, it's important to look at the regulatory part of this. Regulatory compliance is really important to making sure things are running smoothly and you're doing things the safest way. CMS guidelines require all nursing homes to have a water management policy and plan in place. CDC and the American Society of Heating, Refrigerating, and Air Conditioning, or ASHRAE standards, they can provide you with some further guidance. And also your state and local regulations may impose some additional rules. So, work with your local health department to see if there's anything, in addition to those nationally recognized guidelines that you should be doing. But being proactive and compliant, can prevent any outbreaks in the future, any citations or outbreaks in the future. Just wanted to show you guys what it says about water management in the CMS critical element pathway. This is a part of what you're going to be evaluating on during your survey. And like I said, this is not something that the infection preventionist always has hands-on, work with. But it's really important that you know what your water management plan looks like, that you're involved in it, and that even if you're not physically doing the day-to-day management of it, that you know who is and where to find the documentation of all of your testing and whatever else you have in your plan. So the major components of your critical element pathway recommendations are making sure the facility has been assessed. So looking at what the water program, what your water flow is like within your facility. You've identified any areas for risk, and you have the measures to prevent the growth of waterborne pathogens. And also a way to monitor these measures. So your testing protocols and acceptable ranges for any testing that you're doing, whether it be chlorine, if you're testing for Legionella directly, whatever the case may be, having everything in your policy, and also are recommended if a resident has had Legionella since your last survey. A strong water management plan is only as effective as the staff implementing it. So making sure that you have your staff training and awareness, that regular training ensures that all employees recognize the risk and also understand the protocols in place and how to report concerns. So we're going to do a quick case study about a water management plan that might happen in a lobby's decorative fountain. During inspection, that the fountain walls have accumulated a slimy growth. What steps should Michelle take to correct the issues? Just drop in the chat, what you think she should do. Oh, no. All right, we got one thing in the chat. Notify. Okay. So, as dictated by her water management program, Michelle immediately shuts off the fountain, drains it to the sanitary sewer, and scrubs it with a detergent recommended by the manufacturer. She then follows the program's startup procedure to refill the fountain with water and checks the residual air within the documents or observations and the performance of interim cleaning in her logbook and informs her supervisor. So, making sure that everybody knows what their role is in, the water management plan and what to do if there's any issues and, how to report those things. So, just as key points, water safety is a crucial aspect of infection prevention in nursing homes, and a well-structured water management plan combined with staff training and compliance with guidelines can significantly reduce the risk of outbreaks. I want to thank you all for attending today, and I'm going to open up the floor for any questions that you might have about water management.
Thank you, Jen. So yeah, if anybody has a question or comment, please submit it using either the chat or the Q&A tool in your Zoom menu, or you can raise your hand if you'd like to ask your question out loud. And while we're waiting, I'd again like to invite everyone to next week's webinar, which will be on managing common infections in nursing homes. And that will be the same time and place next Wednesday at 2 p.m. You can find the links to our webinars in the newsletter we send out every other Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at ccaudill@qualityinsights.org and I will get you on that list. And now I would like to see if we had any questions. No questions so far. Here is my email and Jen's email if anybody needs to take that down.
Oh, I
Um,
see one from Lana. How should sprinklers be managed? Now, are you talking about like internal, like fire suppression systems, or like sprinklers outside? Either way. So, yes, okay, fire suppression. Yeah, so should definitely be within your risk assessment because there is a possibility, that's rarely used. So it can be a area where there's some stagnation. So so this is why it's so important to look at your risk assessment and like know how things flow. Those pipes that are hooked up to your sprinkler system, is water allowed to flow through them, or is it like a cutoff somewhere and the valve is only open if there's a fire? You know what I mean? So that's why it's so important to have that sort of diagram to see how the water is flowing through. So, and it's going to vary from facility to facility. So yeah, really take a good look at how the water is flowing through your building, um, and look for any cutoffs of water flow, any areas of stagnation, any areas where detergents or flushes can't go through. Those are the areas you want to look at, and you know that might have to be flushed or you know um, tested more frequently, whatever your water management plan comes up with. Um, yeah.
all right, thank you.
Mm.
I can go ahead and wrap us up, but before we go, Jen, was there anything else you'd like to add before we go for today?
No, I just want to thank you all again for your time and attention today. And if you have any questions or you need any resources on water management, please feel free to reach out to me anytime. My contact information is here, and I'll be happy to help you out.
All right, thank you. And since that's it for questions, I'll go ahead and wrap us up for today. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It's anonymous and will show us a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Jennifer, thank you for joining us again today and for this great presentation. And I'd like to thank everybody here for joining today, and we hope to see you again soon.